information management and health administration professional career options for people in programs such as this. These are things, if you haven't already started kind of figuring out where you want to, what directions you want to go, try to maybe give you some ideas, some starting points. And then I'm also going to finally talk about the relationship between Tunsis Community College and Charter Oak, and that was really Candace's brainchild a few years ago. So let's get into that. At Charter Oak State College, I'm the admissions counselor for all our health-related programs, in particular our Bachelor's of Science in Health Information Management. So what is that? For years, it was known as medical record science. Basically, anytime you have an interaction with a healthcare professional, somebody creates a record for the primary purpose that somebody needs to get paid, but also so that you can have a medical history, so that when things reoccur or things change, things shift, you all been to a medical facility or seen a practitioner, I don't have to explain that part to you. But the fact that there's a wealth of professionals behind the scenes that make all those things work. So why do you need a health information management professional? If you've ever talked to a doctor, they kind of speak one language. Nurses can kind of speak to everyone. And then in the modern world, a lot of these things have become electronic. So if you put a doctor, a nurse, an administrator, and a techie in a room, and had them talk about a certain subject, they might speak a different language. There might be some mismatch, there might be some misunderstanding. The health information management professional is the person supposed to be the interpreter for all of that. The health information management professional understands all languages and translates them to something that everyone involved can use. And that's from the patient, who's most important, to the clinician, to eventually some insurance company who needs to get paid, or government needs. Please. So, health information management in particular has kind of jumped off the map for a lot of colleges and professions around the country. When the last administration mandated that medical records become electronic nationwide by a certain date, a couple of things happened. One, it ticked off everyone in healthcare, but more importantly, they realized we don't have enough people to make this thing happen in a short amount of time. And then what happens going forward? If you go to most facilities now, there are no paper files. If there are, they're probably converting to something paperless pretty soon. Because the point of it is, one day, if one of you, God forbid, was on a trip to California and broke your leg, your health wouldn't be jeopardized because someone can get your information in Connecticut because you happen to be incapacitated and too much pain to be coherent. The ability to pull up your records no matter where you are in the country is kind of the main purpose of electronic health records. And again, the health information management professional is the person that kind of makes sure that runs seamlessly, knock on wood. To that end, there is a major shortage of people who can do these jobs. And they range from medical coding to AHIMA directors to database builders, and I'll get into a little bit more of that later. But there's a major shortage. I'm going to show you in a few seconds a few careers. I'm going to ask you guys, if you can, you're going to minimize this. I want you to get online, and I'm going to send you to a website that's going to show you some HIM careers. And it's a little funky tool called a career map. It lists about 70 common professions in HIM. That's not even exhaustive. And I can tell you there's a shortage in probably 60 of the 70 things listed. So the job market is booming, but the economy doesn't have enough professionals to do it. So Charter Oak State College, along with other programs, developed degree programs so that we could begin to create these professionals so that the economy wouldn't have a shortfall. There are many, many credentials in healthcare, and healthcare is very much a credential-driven entity. From MD down to LPN to Rad Tech to Registered Health Information Administrator, and that's where our program comes in. Our program is an accredited program that leads one to ability to earn a certification called the Registered Health Information Administrator. And these are the people now, by and large, who are running health facilities around the country. If you were to go to a directory of Hartford Healthcare or Yale New Haven or Cedars-Sinai, if you ran down the list of directory, you start noticing a lot of designations behind names, and one you'll start to see more and more of is the RHIA. And we'll get into that one in a few minutes. By the way, anyone here working in a medical facility right now? Doctor's office? Okay. Anyone work with medical coding at all? You should. One of the biggest shortages in healthcare, the two biggest ones you hear all the time, I hear all the time. Nursing, not enough RNs. So if you think about being a clinician, go be a nurse. Seriously, if you can do it. And the other one are certified medical coders. They don't have enough people to take all this information, properly coded, properly get people paid. That's a reality. And so that shortfall that was once projected to be about yay big is already this big, and the need is outpacing the qualified professionals in the market. So that's good if you're in the market. Common HIM careers, health managers, HIM supervisors, EHR specialists, this is another big one. Part of that mandate to become electronic, every system had to have an electronic health system to make those records work digitally. But again, not everyone can do that. And even some very large hospitals realize we have 10 people who can do it, we need 150 people to make it happen. A lot of doctors' offices around the country. Forget about the hospitals and the insurance companies. There are more doctors' offices and special clinics around the country. Well, they didn't employ people who did these types of things 3 years ago. Well, now they do because they have to. Two of the biggest electronic health records programs in the country, or EHRs, are Epic and Cerner. And if you work in a medical facility, your records have probably been transmitted by one or the other, or encapsulated in one or the other. In this part of the country, Epic is probably the queen. And Cerner is big in the South and the West, but they're all over the place. There's some smaller ones that you would learn along the way if you work in a profession. But as these entities had become electronic, they had to become digital, they needed professionals to make these things work. And then once you have the system, you need someone to be there to train your people on site. And then once you train your people on site, you need someone to be there to oversee it in case bugaboos happen, because with anything electronic, bugaboos happen. So EHR specialists, if you like working things that are digital, if you like training, if you like teaching, if you like health records, if you like being in a healthcare profession but you don't like to do blood draws or be a clinician, this is another great avenue for you to pursue. So, can you all go online really quickly for me? Can you pull up a browser, any browser? Explorer should work. Doesn't matter which one. Let me know when you got it. Raise your hand when you're there. Browser, cool. That first word, AHIMA, is one of the largest organizations for healthcare professionals in the country, and they're also one of the largest providers of certification exams and credentials for people in this field. So I want you to go to www.ahima.org. Show me your hand when you get there. There? Not there? Almost there? Okay. If you look on the menus on the top, there should be one that says, I believe it says careers and education. Student education and careers or something along that line.
Training and education?
That'll do it. Click on that, please.
Well, we're getting careers line.
I'm going to cheat for a second.
We have your student and career center.
I want student and career center. And when you get there, there should be an option for the career map. And it's going to look like that, because that's what it is. Show me your hands when you have it.
Yeah, we have the same thing.
Internet stopped working. Debug.
Yeah, it's been one of those days. We lost our whole system for 2 hours just now. Still working? Not working? So this is keep going, but we'll get, if you get there, it's cool. We'll want to get you done. Whoa, Candy, I need you back there. Thank you. This is the career map, and they broke the HI profession into 4 sectors. And each dot represents a common profession in HIM. And if that were open for you, you could hover over one dot, click on it, and get a full description of the job title listed. Everything from salary information to demographics to normal career progression. So people who do this usually progress to jobs A, B, or C. The coolest thing here, the little golden kind of diamonds are emerging careers, things that healthcare didn't realize they needed 3 years ago. Because maybe they had a person who did job A, and 5 people did job B, But now there's a job C that needs people who can do both and then something else, and they don't have that. And those are the emerging fields in healthcare. If you take a look at this map from time to time, you will notice these things change all the time. When I first started using this grid about 5 years ago for students, there were 42 jobs on that grid. I counted today there's 70. And the emerging ones change probably every other quarter, which is good. People who are studying at a discipline that leads to office work, to medical work. This means you guys made a really wise choice in this field. Please. So, I am going to pass out, if you don't mind. Of those 70 some odd jobs, I picked a few just to give you an idea. And I didn't want to go and cherry pick just the highest paid jobs to sound fabulous and make this thing sound like something that, while it is, we have to be realistic in our planning. So the first one I selected, medical coding. For people who are even familiar with healthcare at all, this is the entry job they think of the most. And that's for good reason. There are probably more medical coders than probably any other thing on that entire grid. This is particularly fascinating because there's a national shortage of medical coders. If you're certified in medical coding, and there are basically two organizations that offer certifications, AHIMA, and that's the American Health Information Management Association, or the American Academy of Professional Coders, which is AAPC. They each have a different coding certification. But if you earn one with limited experience, you can walk into a job paying in that ballpark in any part of the country, and that's a fact. One of the great things about this particular career is that a lot of these people work remotely. So for people who have an idea, hey, I wouldn't mind working from home, this is a career that a lot of people are choosing. Quick anecdote. One of the people I work with a lot of people in healthcare who come in and speak at events for me or kind of give me advice or whatever. The director of Middlesex Hospital, his name is Mark, he's a great guy. He's one of the few male RHIAs I know 4. It's like 95% females in the country who have earned this certification. And I asked him, I said, well, Mark, hey, why don't you let me come in and give a presentation to your coders? I mean, how many do you have? He's about 45 on site. I said, oh, great. You mind if I come in and talk to him today? He goes, no, it'll be a waste of your time. I said, why? He goes, because 39 of them work from home. He goes, I don't see him every day. I don't see him at all. I have 2 supervisors that come to work and a couple new people who are training, and pretty soon they're going to work from home too. And that's not even a large hospital. But that's becoming the industry standard. Coders work from home. Another quick story, and this is when people tell you stories, did that really happen? This happened yesterday. I'm on the phone with a young lady who's calling about our program, and she goes, well, before I get a bachelor's degree, I wouldn't mind getting a coding degree. Now, this young lady happens to work in healthcare. She's about 15 years of experience at a very large hospital outside of the state. I said, oh, sure, you could do that. We do both at the same time. She goes, well, what got my interest up was my girlfriend is an inpatient coder, and there's a difference between inpatient and outpatient coding. And she goes, she just told me she makes $40 an hour, she works from home. And that translates to about $83,000, $84,000 a year, give or take. And it's not all about the money, because coding is like accounting. You either love it or you don't, there's no in between. If you don't like coding, you won't last for 20 weeks, because it's weird. But if you love it, it's a great option. So this kind of gives an idea. And what I did is I put the top 3 cities looking for coders right now. In this particular case, it's misleading because I could have listed 20 cities and still not exhausted the list. Hartford has a major shortage of medical coders. New Haven, New York, Philadelphia, pick a city. But those are the top 3. So, where do you progress after being a coder? Well, there are many places you can go. But one of the most common is to become a compliance or a coding auditor. So eventually you progress to the point where your job is to make sure that other coders are doing their job. You're not necessarily their boss, but what happens, again, these people almost universally work remotely now. They send you batches, and you may randomly select coder C's, whatever, and you make sure that coder C properly coded these things. And this kind of give you a quick, thing, a quick peek into coding. I've been talking all day. The country switched to a system called ICD-10 about, it's been up 3 years now. Anyone heard of ICD-10 at all?
Yeah.
Don't worry if you haven't. Prior to that, we were on ICD-9. We were about 15 years behind the rest of the industrialized world in switching to ICD-10. And what ICD-9 was, if you had a broken femur, there was a code that said broken femur. But that same code also meant broken tibia. It could have meant broken ankle. Basically, you broke something in your leg, there was basically one or two codes you used. ICD-10 is much more specified. Every particular bone or group has its own specific code. So people in the field who've been doing this for 30 years had to learn a new language almost overnight. Well, a lot of people are retiring, so anyone coming into the field now has to know ICD-10. Just give you an idea. And again, this is one of those things where if you don't like this type of work, it can be monotonous. People who like it tend to love it. And again, it's like accounting. You love it, you hate it, and there really is no middle ground. But eventually you graduate to be the person who checks to make sure auditors or the coders are properly coding things. That's important, not only for your physical care, to make sure that you're getting proper treatment for the proper thing, also respect your records. It matters to the insurance companies who want to properly bill. And this is where the arguments become over what got treated, how much treatment, what are we going to cover. This is where that starts with the medical coding. I mentioned the EHRs, the electronic health record systems. And again, I talked about training before. That's the national average salary for a person who trains people to use electronic health record systems. And again, it's actually a little bit higher in New England, higher in the middle Atlantic states, much higher in the West Coast than that number. I think the West Coast number is somewhere around 85,000, give or take. Not all about the money. But another thing about this profession people like is that people are allowed to travel very often. A company may hire one person, you might be their regional rep covering blank. Chicago, Indianapolis, and Detroit, who knows? So this one offers a lot of mobility for folks. Again, if you have that teaching gene and you like this field, this kind of gives you a chance to marry the two things. Skipping back to coding. Once the coding is done and someone's checked to make sure the codes make sense, a reimbursement specialist goes and tries to make sure someone gets paid and that you don't get overbilled or that you don't get underbilled and the wrong person doesn't get paid. And I broke that down. This actually has several layers, but the entry level for reimbursement is a reimbursement specialist. Top 3 cities: Chicago, Atlanta, Dallas. If I show you this list, you can find this on salary.com, so you don't have to take my word on it. You can go to Indeed.com, AHIMA's website, AAPC's. There's a lot of people tracking these things. You will find that Texas in particular seems to be short of everything. Texas is a booming economy right now, so it makes sense. They have a growing population, they have an aging population, they have a young population moving in, and it's a huge state. Atlanta is saying it's growing, kind of same dynamic is going on. New York City, Boston, which is kind of driven, Boston's whole economy premises rests on healthcare, which is good for Boston. Tumor cancer registrar. Many places call it one or the other. This one is the person who's responsible for tracking all things related to treatment of cancer patients. All things. So this is the health information management specialist inside of the health information management specialist, particularly concerned with cancer patients. The documentation specialist. This is the person who makes sure the paperwork all makes sense. This also has many layers. I gave it a specialist too because this is the person who has a bachelor's degree, more than likely, was probably a coder at some point, or is going on to become an RHIA. And that's where they will start. There are 2 levels above that and 1 level below that. So I kind of just chose that level. And I gave you brief descriptions on the little thing I handed out. The little brief descriptions again from salary.com to kind of give you insight on those jobs. But if you go back to the job map, the career map I mentioned, you get much more in-depth information than I'm providing right now. Any questions right now? Making sense? Boring you to sleep?
No.
Okay. So, Charter Oak State College. We are State of Connecticut's public online college, created in 1973 with the primary purpose of helping women, and only women at the time, finish their degrees. My colleague Doris Castay, who passed away a few years ago, she was in her early 90s. I can say that now, she's not here to smack me for saying it, because she could outwork me on any day. She actually wrote the legislation that became Charter Oak State College. It stayed with the college through its entirety. So I have to say that I have to give Doris credit because Doris deserves credit. Eventually the school became co-ed. It started in a library in Stamford, Connecticut, and eventually moved to Hartford, Farmington, Hartford, New Britain. And that's where we are now. We've been there for quite some time. We're actually physically located on part of Central's campus. We have our own building. We actually have two buildings. One, our main building where I work, and then we have a smaller building in New England. But anyway, student profile. We're currently about 2,800 students. Our average student is actually 38 years old. Again, we do specialize in adult learners. You can be as young as 16. We don't have a lot of 16-year-olds. We always have one or two. About 90% are employed when they start. Half our students go on to graduate school. That's a number we are proud of. 96% satisfaction rate. Full disclosure, that used to be 97, so we got to work to get our 1% back. And our course completion rate is 90%, which is fairly good across the state school spectrum. I'll do this. Okay, so the thing that makes our AHIMA program valid is that it has a separate accreditation, and that accrediting body is known as AHIMA. And I won't even get into everything they do, but they're the people that, if you start an AHIMA program, that's great. You can offer a bachelor's degree, but if you want your graduates to be eligible to sit for the RHIA certification, which is the national certification, you have to meet KN's accrediting standards. So it was a long process. You have to start your program, you have to enroll students, you have to do it for 2 years before you can even apply. They then pick you apart for about 1.5 years, and when you survive that, they come and visit you in person, they pick you apart in person, but they're very friendly. And they let you know if you did it right or not. The good thing is if they schedule a visit, that pretty much lets you know you're pretty much home. You'd have to do something pretty off the reservation to kind of get in trouble after that. But it happens. That's not okay. So our particular program is combined. It's a combination of science, management, healthcare-focused management, and a couple of other competencies. As much as this career is involved in technology, you do not have to be a techie to do it. Our curriculum has like 9 credits in technology. It is mainly focused in management competencies and how those competencies pertain particularly to healthcare. You don't have to be a science whiz either, but of course you want to have some familiarity with anatomy and physiology and disease and the nature of progression, because even as you're working as a coder, you have to make sure that what you're reading makes sense before you start coding. Curriculum samples, some things you guys have taken here and beyond. Medical terminology, human biology, A&P, medical coding 1 and 2. Data analytics, which is huge right now. And I don't care if you stay in healthcare or go beyond. If you are an analytical mind, if you have an analytical mind, if mathematics does not scare you, if you like solving things, making sense of things in a numerical way, data analytics across every spectrum is vital. We had a CEO tell us of a very large company, I have 100 people who can get me information in 100 different ways. I have like 4 who can tell me what it means. That's a bad equation. The information is great. It means nothing if nobody can tell me what it means, or more importantly, what I can do with it. Give me a bunch of numbers. Is that good for my business? Should my business pursue that? Should my business stop doing that? If no one can crunch it and break it down, you got a bunch of numbers. Again, we're a state's public online course, so everything we do is online. You never have to see my ugly face. But if you want to come visit for a counseling session, questions on financial aid, bill issues, which we really have, thank God, you can certainly do so. Again, we are online. We currently have students in 44 states and I think 9 countries. Of course, obviously people don't come see us very often. But if they want to, they certainly can. We are a semester-based school, so we have a 17-week fall, 17-week spring, and a 12-week summer. But most of our courses are 8 weeks. So that's basically, we break our semesters in half. Term 1 is the first half, 8 weeks. You get a 1-week break. Term 2, second half of the semester, and then you roll on to the next semester. We pretty much roll all year long. The largest break in our calendar is the end of the fall, which is generally the week of Christmas, and the beginning of the spring, which is generally the day after Martin Luther King Day, on the 50th anniversary of his assassination today. One of the things that makes us unique is that we do a lot of things. We accept credits from multiple sources: testing, life experience. But the best thing in that realm are credentials, because we have students who come to us who don't have a degree, but they are a certified coder, because you don't have to have a degree to become a coder, or they're a document specialist, or they are an RN with a 2-year degree. They want to earn a 4-year degree. not necessarily wanting to get a BSN, which I don't know why they wouldn't, but they don't. And that's their choice. LPNs, etc. Those credentials, just present them, we automatically grant credit for them. For students who are interested, you would find me, ask me any question you want, do your own research. Eventually you would apply, submit transcripts, we'd evaluate your credits, we get you started. That's enough about Charter Oak. The reason I'm here is that 4 years ago, the BOT directors from Tonsis, and Manchester Community College and Gateway, they got together to do whatever smart people do. And they happened to meet at Charter Oak one time, and lo and behold, we decided that they wanted to build a relationship with us. And so, your curriculum was mapped to an articulation agreement so that what you do here feeds directly into a bachelor's degree at Charter Oak State College. In particular, the Health Information Management bachelor's degree. You could technically go any route you want. The degree, the current agreement is written for that one program, but you're not necessarily limited to that. However, with what you're doing here, and the things that is kind of gave the surface of professionally at HIM, I'd be a little weirded out why you go a different way, but you could. But the hard work of smart people put together a degree plan on paper so that honestly you could sit down with me, or actually Candace, or whomever, and we could show you that the course X you took here satisfies requirement Y at Charter Oak, and all the credits you have here feed seamlessly into Charter Oak for the most part, and here's what's left during that bachelor's degree. Make sense? Makes sense. All right? Why do you look so familiar? I don't know why. You look so familiar.
I don't know, I'm from Florida. You from Florida?
No, but I go all the time. Going on Saturday. Going on Saturday. Actually, I'm going twice this month. That's me. That's just my name. Any questions? So I'm going to stop talking right now. Anyone have any questions about anything I covered? Anything I did not cover?
How much longer is it to get a bachelor's?
Good question. We don't mandate course schedule at Charter Oak. Again, because our population is predominantly working adults. Most have families. We don't do course minimums or course maximums. When you start, especially if you're new to online learning, we try to persuade you to go slowly. So that might be 6 credits your first semester, maybe 9, which is kind of, an average student starts with 7.3 credits if you break that number down. So, combination of people who do 2 versus 3 courses. Once you're acclimated, we pretty much leave you alone. We recommend courses for you. We try to stop you if you're doing something that doesn't seem to make any sense. One of the things about being online is that it takes a lot of self-discipline, and you have to be very much self-motivated. Our job is to encourage you to make sure that we can avoid any hassles, any hurdles to your ambition. But we also are there because if you put course X and course Y together, and I know that would be a terrible 8 weeks, we try to talk you out of that. At the end of the day, you're the captain of the ship. So you say, now I'm doing that, or you're doing that. So there is no real answer. It's a 4-year degree. If you have an associate's from Tonsis, you're basically halfway home. Does that mean you're going to finish in 2 years? I don't know. The only person where I can answer that question is you, and you can't answer it until you start. I've seen people show up with 60 credits and take 3 years, and I've seen people with 60 credits do it in a year and a half. It depends on your particular situation. That makes sense?
Mm-hmm.
Okay. Anything else? Nothing? I'm not that good at my job, so that means I'm really bad at it.
How are my students doing over there?
Oh, my God. Really well. Thanks. Our program is fairly young, and so we've just started seeing our first graduates in the past year. And you have one coming up in May, and knock on wood, one coming up in August. So we confer degrees 3 times per year. In May, August, and January. We have one commencement in June. And for some reason, she's not registered for commencement, so I'm going to call and yell at her in a few minutes. I'm going to call him back to show him. But anyway, so I think we have, last time I counted, 6 people in our program. And that's a good number from our agreements. And we have agreements with schools all around the country, but in Connecticut, I don't think any singular program has more than 6 people. I think Manchester, we have 4 from that BOT program. But can't think of any specific program that has more than you guys right now. But officially, I can't give you their names.
No.
She can figure it out. And if you want to talk to them, I'm sure you'll be more happy to talk to them.
And we also have your instructor, Robin Alina, who's also graduate of Tunsis,
And Charter Oak. And Charter Oak.
who has numerous certifications.
You all have
We're
Robin
very
as a
confident.
professor? I love her voice.
Plus she works at my work.
Oh, does she?
But she works from home, so I've never
She works from
met her.
home, yeah. This is the room, I really saw.
Yeah, half an hour.
I love her voice. I know when she calls. She calls me every once in a while. I know the second I pick up the phone. There's only one Robin. Anything else? No?
Well, we'd like to thank you very much for
Oh,
taking
my
the
pleasure.
time.
Now, you guys are finishing up, right? You're at the finish line?
Yeah.
Mhm.
So,
Getting your e-portfolios ready? What do you call them? We call them digital.
Is there another e-portfolios?
Who's
And
ready?
just so you know, Moses is also on our advisory board, so you will get 2 lucky people from here.
Oh, really?
to
That
review.
choose?
Mhm.
That's always a lot of fun. I've done Kansas Academy 2 years. It's amazing what you guys put together in those things. It's a tool we don't use. I wish we did. And we do a lot of portfolio work at Charter Oak. It's a tool we just, quite frankly, too cheap to buy. But the stuff you guys put together is amazing. The progression of it, how you guys tie it together. I've been floored. I think I've seen 5 in my 2 years and been amazed by what you guys do. So good luck. Good luck. You are going to attend commencement, right?
Yep.
Right?
Oh, yeah.
Okay.
I know where they are.
Oh, I am.
Oh,
6.
oh.
I'll be there.
Okay. Don't give up that feeling. It's best feeling in the world. Best legal feeling you ever had.
As far as everything being online, I guess this would be a concern of mine, because here, like, say you need tutoring or whatever, it's here.
Yep.
But at a university, or
We have online
state
tutoring.
college, oh, you do, okay, that's my question, like, what if you're,
We have
you know,
online
that's a
tutoring.
bachelor's program, it's gonna be a little tough.
No, it's a good question. So we expect our professors in particular to be responsive to our students. We take our student surveys very seriously. So at the end of the year, if we hear professors aren't responsive, that's addressed immediately. But we have online tutoring continuously, and you have an academic advisor. So the way our process works, you get stuck with someone like me. My job is to get you through the admissions process, your credit evaluation. I recommend your first courses. I help you register. And then you get an advisor, and that person stays with you. That person, if they can't personally, and we do it by discipline, where people have some experience. If they can't personally help you, the online tutoring can. If not, they'll get in touch with someone who can. We can't afford to have our students just floating around. You know, being not physically present, it'd be really easy to become disjointed. So we can't do that.
Well, that's because I was taking a coding online through the
Where?
AAPC.
Yeah.
And it was so hard because there was nobody to ask questions, so you were kind of like, here,
Yeah.
and I quit it because it was too hard for me.
But, well, here's one thing I would say. When I have students who have a program or course that they're a little worried about, and for my students, it's pretty much math. Adult students online don't want to do math. I always say go back to your local community college and take statistics. Take it in person, so you can still get that. Cost you nothing to transfer it back. But when you're with us, again, we have a resource for you to reach out. It's always literally a click away. You might have to wait a couple hours to get some feedback. I'm not going to tell you it's real time, but you will get feedback. But yeah, coding is tough. I mean, coding is,
Well, the thing is, like, we took it here, but they weren't doctor's reports. So when you're doing it at home, they're doctor's reports, you have to dissect them, so it was a lot more difficult than coding one thing, you know what I mean?
were you preparing for the CPC or are you just taking it because?
I wanted to do that, yeah.
Yeah?
Which I still want to do it.
Good, good. The difference, it's funny, the difference between the AHIMA, the CCS, the Certified Coding Specialist, or the CPC through APC, when I first started doing this a few years back, people had opinions on which they preferred. That has kind of gone away in a matter of 5 years. Students prefer the AAPC one because it's cheaper, to be honest. The curriculum is tough. That exam, I had a young lady who recently, she's during our program, her CPC lapsed. She got busy during the ICD-10 upgrade. She was in charge of her department, didn't do her CEUs that year, and hers lapsed. And she told me, I don't care if they threaten to fire me, I'll never take that exam again. And she passed it. It's tough.
I worked with a girl, she had to take it twice.
Really? Thing with AAPC though, you get 2 bites. So for one class, you get 2 bites at it, and they run a lot of discounts on their training programs. But no, it's not meant to be easy, and it's not. So I don't envy you on that. I probably would have dropped it too.
Well, my teacher offered to help me,
See,
yeah.
teachers make a real difference. Anything else before I get out of your way? No?